Hi, everyone. Welcome back. And I hope you had some time to get a lunch or some refreshments or just stretch your legs. So we're now back for the afternoon, which is more fantastic presentations. We have two panels and two keynotes for the afternoon. But the first panel to kick things off is entitled Informing a Framework for Anti-Racist Research at ICS, a Vision for Community-Led Data Governance. The moderator for this panel is our very own Laura Ferreira-Legere. Laura is a Senior Manager, Public and Community Engagement and Knowledge Translation at ICES. She's a registered nurse and completed her Bachelor of Nursing in Fredericton, New Brunswick. She was an expert panel member for a best practice guideline on promoting 2S LGBTQI health equity and has worked with numerous stakeholders and public patient panels in her past roles. So over to you, Laura.
Great, thank you so much, Michael. I'll share some slides on the screen there. So good afternoon, everyone, and thank you for joining us for this session on informing a framework for anti-racist research at ICS, a vision for community-led data governance. Next slide, please. The plan for today's session is to provide a brief background on the guidance document and framework that we are developing at ICS, how community-led data governance is incorporated in that framework, and then hear from our panel members today on what community-led data governance could and should look like at ICS. Before we begin, I will have our panel members briefly introduce themselves, and we'll begin today with Bilal Khan.
Thank you so much, Laura. Hi, everyone. My name is Bilal Khan. I'm a research coordinator and a co-chair of an equity committee at Women's College Hospital, and I'm looking forward to the discussion today.
Great, thank you, Bilal. And Bilqis Williams.
Hi everyone, a pleasure to be here with you. I've been a patient and a partner for half of a decade now. My background is in medicine and my experiences span across policy, advocacy, public health, which includes research, addictions, sexual trafficking, and incarceration. Thank you.
Great, thank you so much, Bilqis. And Gurjit Toor.
Hi everyone, I'm Gurjit. I'm the Health Services Director at Southeast Ottawa Community Health Centre and Privacy Officer. I'm also a registered nurse with my Master's of Public Health and Epidemiology, and I'm really looking forward to today's conversation.
Great, thank you so much, Gurjit. And Manvir Bhangu.
Hi everyone, good afternoon. My name is Manvir. I am the founder and executive director of a community-based nonprofit in Peel Region called Lardian Celebrating and Empowering Daughters. And it's a nonprofit that focuses on gender equity within the South Asian community. And I'm also a community-based researcher as well.
Wonderful. A sincere thank you to all our panel members today. We're really looking forward to the discussion. Next slide, please. So before we begin our panel discussion, I'll provide a brief background on the guidance document and framework that we're developing at ICS on the appropriate use of race and related data and how we're putting what we're hearing from community consultations into action. So for those of you not familiar, historically ICS has limited but well-used data on race, ethnicity, immigration, and socioeconomic measures, not all of which are self-reported, which is often considered the gold standard, or at an individual level. In 2020, there was increasing interest in understanding how COVID-19 was disproportionately affecting racialized and immigrant communities across Ontario. The Ministry of Health began collecting certain race data in relation to these COVID-19 cases. It was also around that time that there was widespread and more global acknowledgement that race is a social construct. Experiences of racism are central to poor health outcomes experienced by racialized individuals. Also in 2021, the Black Health Equity Working Group released the Engagement, Governance, Access, and Protection, also known as the EGAP framework, describing governance needed for the collection, management, analysis, and use of data specifically from Black communities. The EGAP framework emphasized the importance and current lack of appropriate data, analytics, community governance, and community engagement and research. All of these aspects really culminated into a greater push for development of data guidance at ICS. So why do we need race and ethnicity data guidance and governance now? So although there are data controls currently in place, there are no current guidelines around the use of race, ethnicity, and immigration data at ICS, but a strong desire for that data to be used appropriately. There have been concerns raised about certain practices related to the use of data, and specifically algorithms that may assign race and ethnicity. Harm, and in particular stigma, to certain groups can occur when the guidance for data use and governance is not in place and or not appropriate. We also know that we've heard from communities, equity groups, and organizations themselves calling for an anti-racist approach and are asking that their data are used in a responsible manner and governed by communities themselves. Most importantly, research using race and ethnicity data appropriately can address systemic racism, prevent harm, and reduce racial health inequities, all of which is ultimately what ICS strives to do with data in our repository. With that, the development of a guidance document and framework began. There are 3 core groups that have been involved in the initial document development. We have our core committee of staff at ICS. We have a larger internal committee of ICS scientists. And we also have our People's Panel and groups of equity experts. The People's Panel was a group of over 50 community members who met first in the spring of 2021 to discuss early insights around guiding principles that could shape this work. This led to the development of a framework to drive anti-racist approaches to health research at ICS, with 4 key domains you see here, one of which being community governance. The framework was also largely informed by principles for the appropriate use of race and related data, informed by community members. The guidance document, which outlines the actions of all domains, including community access, anti-racist research, and accountability, is currently undergoing internal review before a wider release in the near future. Focusing a bit more closely on the community-led data governance domain, there are several steps that must be taken to ultimately shift this plan into action and co-design a structure at ICS to guide initiatives involving race and related data. In the short term, and what we will be discussing with our panel today, is a focus on initial consultations on potential community governance structures and aspects to consider when formulating an approach. As we progress, we can also begin to build meaningful relationships and co-design a plan and a path forward that outlines the goals, activities, and processes needed to achieve a community governance structure at ICS. In the longer term, when that plan is launched, an advisory table will be key to guiding these efforts and ensuring accountability to our approach. Now that I've provided some background on why we want to focus on community-led data governance and create actionable solutions, I want to begin our panel discussion to hear more about what governance should look like and what are some key components to success. With that, we'll stop sharing the slides and begin with our first questions for our panel members today. We will leave some time at the end of the discussion for audience questions, so I do encourage you to type your questions into the question tab. And during the discussion, at any point, you can enter those questions and we'll look at those at the end. And feel free to also indicate which particular panelist your question may be directed to. So with that, I will hand it to our panel members for the first question. So not everyone may be familiar with community-led data governance and what it could look like and what it already does look like. From your perspective, what are exemplary models of community-led data governance that we could learn from? And what should community governance of race-related data at ICS look like in an ideal world? So I want to give everyone a chance to speak to this question. So I'll start first with Bilal, if you'd like to share your thoughts on this.
Sure. Thank you so much, Laura. So I think it's one of the exemplary frameworks, and something that you mentioned was the EGAP framework, the Engagement, Governance, Access, and Protection framework. And just a little bit of background about this. It was developed early in the pandemic by Black health sector leaders and equity experts in Ontario due to the disproportionate impacts of the pandemic on specifically Black communities. And so the principles of this framework really promote intentional, genuine, continuous engagement with communities in regarding their data, decision-making power to communities around their data, right to access data and determine who accesses it and who uses it and for what. And lastly, protecting privacy and anonymity of individuals' data. So knowing about these principles from the EGAP framework and many more that I'm sure my fellow panelists will mention, I believe that an ideal state would require ICS to invest in communities with well-intentioned and ongoing engagement. And more importantly, there must be checks and balances in place to ensure that data governance is truly guided by and benefiting the communities that it's about.
Thank you, Bilal. And I just shared the link to the EDAP framework as well for those interested. And I'll pass it to Bilqis, your thoughts.
So, part of there are four principles in First Nations information governance that are particular to this topic exactly. And one of those principles that I find really important and really pivotal to this conversation, as well as very relatable to our conversation here, is ownership. So I'll just list the four principles so that when if someone were to decide to read upon it, you would know what direction you were going to. So those four principles include ownership, control, access, and possession. And if you were listening to Bilal, you'd see that access is one thing that actually transcends all both the Black Equity Initiative as well as the First Nations information governance initiatives. And this is why it's really important that ownership is central to the conversations, because First Nations communities regard ownership in the relate as how do I say it, as related to the relationship to cultural knowledge and data information. For them, it's when you take one person's information or one person's data, it's as though you've taken the collective data or collective information of the whole community. So, and in ensuring that that ownership principle is adhered to, it's really important for community members to be part of what that data is used for. And in short, what I'm trying to say is, if you're going to use a person's data or a people's data, make sure that that people or that community or that person is represented when you're translating, imputing, using that data now and in the future. Thank you.
Thank you so much, Bilqis. And Gurjit, did you want to expand on that a little bit as well?
Definitely. I totally echo the points that both Bilal and Bilqis have made. And, when we look at that ownership and when we look at that perspective around, why the data was collected, the intent, the kind of values that were, and the principles and the thoughts that were utilized in creating that need for that data and then collecting that data, they have to be consistent throughout, all the way to analysis and use and in terms of what that data does for a community. It needs to do something for a community. And I, in the research and academic world and in the science world, often, it is the researchers' interests that play the central role in this work in terms of the types of data that's collected, how it's collected, the intent of that data. And we need to shift that. We need to shift that back to the people. We need to make the benefits about the people. We need to, the people who are equity deserving groups and have often been harmed by this data analysis or data collection and use. So we really need to take a look at the power that our research world has, our data holders have, and shift that power back to the community. It will benefit everyone in the end. It'll benefit the researchers. It'll benefit the folks holding the data because there'll be a lot more richness to what comes out of that data. And, my colleagues have mentioned the EGAP framework, First Nations data governance. The Indigenous Primary Healthcare Council is also doing its own work in the Indigenous space around data governance being one of its top 4 priorities. And they've developed a framework that's applicable at the provincial, federal, and local level, and really is looking at the gaps in primary healthcare coverage and Indigenous data. So those are things that I think we have a number of different groups who are able to provide really good insight and knowledge and expertise. I think they need to be heard, they need to be valued, their expertise needs to have recognition, and we really need to bring that to the forefront. And the other thing, was mentioned earlier around, the indigenous data, there's a lot that's tied to the holistic health and well-being and the traditional practices, and looking at data not just from the Western approaches, but looking at it from their traditional approaches as well. I think that's super, super important. The only other point I'll make about this Indigenous Primary Healthcare Council is they've developed the first Indigenous privacy framework, and they are also doing a lot of work in the data sovereignty piece. So lots of great work happening.
Great, thank you so much, Gurjit. And I also posted a link to that document in the chat as well, and we can share those after also. And then lastly, Manvir, any additional points you wanted to close out on this question or that you envision from your perspective?
Sure. So I echo everything that was said already, and I think they covered majority of my thoughts as well. I think Gurjit's point around making it people centered is so important when we talk about data. It has to be people centered. It has to, in an ideal world, we have decolonized data, which keeps the community at question in the center, and that's about it. It's easy to say, but it's obviously very difficult to do, which we'll also get into later in the panel. But I think having a people-centered participatory approach would truly have inclusion in data that we're looking for, and making sure that the communities that are involved have the ability to exercise their rights and hold people accountable for the through the policies and programs that are developed using these data. And we also want to make sure that when in an ideal world, as we're speaking about that, we want to develop platforms that are useful and accessible by the target populations, right? Otherwise there's really no use in doing this work. And I think as someone who works on the ground with community a lot, I think sometimes our biggest challenge is feeling seen or represented or having access to the data that we need. And I think that's, and that's speaking from very grassroots, a very grassroots level. So to ensure that we're successfully engaging community, we have to have a collaborative approach where people are at the center of that approach.
Great, thank you all so much on those comments. And absolutely, there's so much that we can learn from the work of the Indigenous portfolio, even here at ICES, and the work of other organizations that have been doing these efforts. So I also encourage you to check out our own Indigenous portfolio at ICES for more information on the work that they are doing as well. So thanks so much for everyone for helping to lay that groundwork and many of the principles that have been established, and to understand a little bit about the direction that we could potentially go in. So to help fulfill a vision of what community-led data governance should ideally look like, what do you believe are the first steps that ICS should take to establish an approach that is also mutually beneficial, which I think is really important, and you had touched on a little bit in that first question. So I'll have Gurjit and Manvir tackle this question, and maybe Gurjit, I'll hand it to you first.
Sure. There's a number of things I think ICS could do right now. One of the things is to definitely review its current practices with existing data sets that it has, that control and oversight over, and really look at that from an equity lens, and look at how its current, ways of doing things is either benefiting or harming populations. And of course we can't look at it from a broad stroke, well, let's just look at the BIPOC folk. You need to look at Black communities. There's within Black communities, there's so much diversity, and you need to look at it from many different lenses, lots of intersectionality of identities. When we look at the Indigenous population, when we look at the folks that are, identify as brown, other people of color, we need to look at everyone, not just with a sweeping brush of, here's the South Asian population, right? So we need to really look at people as people. We need to bring the humanity and heart into this work. I think that's really, really important. We can't just look at, quantitative data from a cold perspective. So I would really love for ICS to really, undo some of that harm, look at its current practices, and focus on what it could do with it, what it has currently, before it goes to focus on collecting additional data. I think that trust needs to be built first.
It's a great point. Thank you so much, Gurjit. And Manvir, did you want to build on that a little bit?
Yeah, for sure. I think the first step would be to audit, your current approach and any gaps that exist, or the gaps that exist within it, and at all stages, right? When we're talking about data collection, when we're talking about after the data is collected, during the data collection, and then also the use of the data. Are we being thoughtful? Are we being anti-racist? Are we building relationships with communities that are at risk of being marginalized to help clarify, what they need and what needs to be counted in this data, and how to embed those needs of the vulnerable population in new approaches that we create. And also, I think there's a lot of really neat stuff that's already been mentioned that's out there. So I don't think there's a need to reinvent the wheel, but maybe just looking at best practices that exist and using those or leveraging those and learning from other communities on how they've done it, and in that way, I think fostering inclusion, you don't need to start from scratch for that. Some people have already championed that, and then looking at the small changes that we can make, I think would be would be a first step in how to kind of begin this process of community-led data governance.
Definitely, and I'll just add a couple things. In terms of work that's existing, there's lots of great publications out there. I think Laura's going to put some in the chat, so you feel free to thoroughly read these frameworks that exist. Engage the people who put them together. There's amazing leaders that have done this work. They put a lot of blood, sweat, and tears into this. It means a lot to these communities. These frameworks mean a lot. And so I think just really respecting and valuing and cherishing the expertise that exists in the province, in the country, and really enhancing it, giving it the profile it deserves.
That's great. Thanks so much to you both. And I did include those links in the chat. And I see Michael also made reference to our own Indigenous portfolio at ICES. So that link is also in the chat for anyone interested in taking a closer look. Great. So moving on to our next question. As we know from other models and structures of governance, many of which we've been kind of discussing so far, establishing a table or a council is often a suggested and critical part in ensuring that community voices are truly at the forefront of this work. From your perspective, if ICES were to establish a governance table or council to help lead these efforts, what qualities should be sought in individuals, and how should we conceptualize ensuring appropriate representation is actually at the table? So for this question, perhaps I'll start with Bilal and see if you wanted to discuss some points on this.
Definitely. So I think developing a table council that will amplify the voices of the communities is an integral part of this process. Off the top of my head, I think there's several qualities that individuals sitting on this table should have, including a strong advocacy and social justice background, and prior experiences collaborating with communities. More importantly, I think a deep knowledge and astute understanding of the communities they represent, including past and present issues that have been faced. And then lastly, building trust, which requires reflexivity, active listening, and relaying the concerns of the community. Truly, it's about table members that can challenge their own preconceived biases as well, and are willing to unlearn by listening. And so more commonly than not, communities have distrust with institutions of power, specifically hospital and healthcare and research, with many past and current examples. And so people who sit on these tables should not reproduce or perpetuate that distrust. And so when conceptualizing appropriate representation, it's important to recognize that one individual cannot represent an entire community. But I think it goes back to Gurjit's point about taking an intersectional approach. So you can find individuals with some of the qualities above, that take an intersectional approach and amplify the diverse identities, experiences, and needs of a specific community.
Great. And we may have lost Bilqis, who was going to speak to this point as well. But I was going to ask also as kind of an add-on, and anyone can feel free to jump in on this. Building trust is such an integral part of this work. But as Bilal mentioned, there's a lot of mistrust, kind of historical context there. I'm just wondering if anyone had any thoughts on, really how you get started on rebuilding some of those trusts, especially when there's such kind of long-stemming historical and deep-rooted issues. So anyone can feel free to jump in on this one. I don't know if you had thoughts.
I'll jump in. I think we've all mentioned, I think, key factors in building that trust again is, of course, engaging those communities, the expertise within these communities that exist, and really, if we just start with the frameworks we shared, just giving them their due, acknowledgement and amplifying that work, and respecting that work as an expertise, and realizing that this is a way forward for us to start building those relationships and rebuild and starting a dialogue. I think that's a huge thing. This is going to be a long-term strategy. It's going to be sometimes very painful for everyone involved. And I think coming at it with the lens of that recognition that this is going to take resources and time and energy, and it will take its time, and you're going to have to be patient with the communities as well. There's going to need to be a lot of work that's done in order to create that trust, I think, and really start to move the needle forward. So I do think it's possible. I don't want folks to feel too weary of the work ahead, but I think it's totally possible. I think there are parts of the healthcare system that have been collecting this type of data, community health centers being one of them. I won't say that we're perfect as community health centers, but we do have a long history of collecting this type of data. We have a long history of having community governed boards that lead us. We have community engagement frameworks. We have relationships in the community. Many other community organizations, non-CHCs, also have those relationships. So building those relationships with existing organizations that have that, who could also use the support of organizations like ICES to do our work better, right? Like, we also could use the help to be better for our communities. And I think if we all start to work together, it would really amplify that trust.
Great. Thanks so much, Gurjit. Those are excellent points, and absolutely about collaboration and working together is so key. Manvir, Bilal, I just wanted to see if there's anything you wanted to add to that.
Yeah, I think it's really important, when we, everyone here understands what data governance is, everyone understands this language, the words, but it might not be so simple for someone in the community, right? And I think sometimes we're so far removed from that, and we need to think about ways that this makes sense for, a senior, for example, a senior in my community, for example, who really doesn't, they don't see the connection between why data may be important, why data collection may be important, why data governance may be important, but to help them understand that. So I think working in that way is also very important when we think about how to engage our communities. We want data governance, community-led data governance. We want that, but how do we trickle that, down to those community members who this impacts, right? Like, we want to make sure that, I want the seniors in my community to understand, hey, like, if you're being asked something at a CHC, you're accessing for support, this is what's going to happen with that information, or this is how it can benefit you, for example, right? And I think about newcomers, and I think about seniors, and I don't think it's top of mind for them, or it's even language that they're familiar with, right? Or terms that they're comfortable with. So how can we break it down so that the average community member understands the importance and the benefits of it, so that we can leverage that as well, right? And make it even more impactful and beneficial for all of us.
And I'll just quickly add on, sorry, Laura, and I think Manvir and Gurjit really did include some great examples. And I love the fact that, simplifying it and explaining it in a way that is actually understandable to multiple community members, to people across different, diverse backgrounds is really, really important. But I think a lot of like Manvir talked about it, the grassroots organizations, there are already people working in the community that have that relationship building and trust with these communities that Gurjit was mentioning, and leveraging those and also building upon those is such an important aspect of this. So there's work to be done, but there's also great examples out there.
Thanks so much, Bilal. And Bilqis, that was great timing. We were just talking about our third question, and we were just kind of building a little bit on that about how to build trust. But I'll just reiterate the third question again and see if there's points that you wanted to add. But essentially, we were asking, from your perspective, if ICS were to establish a government table or a council to help lead these efforts, what qualities should be sought in individuals, and how should we kind of think about or conceptualize appropriate representation at the table? And then, just as an add on, too, if you wanted to talk, everyone's kind of like built a little bit on the concept of building trust. By all means, feel free to add any points from your perspective.
Thank you. I was very worried for a minute there. Anyway, I do believe that some of these conversations have evolved to inform this question. And that is because in the past, it used to be criteria. It used to be an inclusion or exclusion criteria to be part of a council or some sort of advisory table. However, it has now transcended or evolved into qualities. And why this is important is that criteria is very strict. It doesn't allow for any flexibility or expansion or even progression. However, with using qualities, now that's a tool that can be improved upon. And so one of the things I would say is that when you're looking for an individual to engage in issues as important as this, look at that person's disposition to equity, because as we know, equity can be unfair. However, the outcome is often fair and the outcome is often welcome. So we will focus on the outcome as you look for someone who has interest and conviction in the process of equity for the greater outcome or for the greater good, because that allows for adaptation. It also allows for community input. It allows for flexibility. And one other important thing that I would like to say is that it's important to mix both a new person, a person who's a novice or a naivete in the issues of policy, so that they bring that fresh eye, a new perspective to the discussion, as well as someone with experience, someone who knows how these discussions and issues have evolved, the progresses that have been made, the gaps that continue to persist, and may be able to, anticipate obstacles that may evolve as a result of a new direction. Because as we know, there are new problems. It's just the way that those problems, appear. And so someone with experience may be able to give that perspective or that reference and say, we've done this before. It wasn't as successful, because that's something fresh blood may want to say, we can do it this way, we can do it this way. However, the wonder of having a fresh eye and of the naivete is that they're not constricted by obstacles or barriers that they've encountered in the past. So they're more than willing to try new things that may be riskier. But so there's advantages to this. Again, I'll reiterate, equity lens is what you're looking for. Someone who's able to adapt, grow, someone who's willing to listen. Thank you.
Thanks so much, Bilqis. And I think it's a really important point to consider too, just in terms of, having that balance of experience on the table and then all those other kind of qualities that you talked about. And then just a quick follow up to see if you had anything you wanted to add. I know you didn't hear all the responses, but we talked a little bit about building trust as well. If there's any additional points you wanted to talk about in terms of like how do you build trust within communities?
Uh, trust is based on trust. That's how I say it. You have to give something. Something's got to give. You an organization that's coming into a community needs to put off the right vibes so that that community is able to trust you. You can't come into a community and expect them to trust you wholeheartedly. You've got to show that you've got to set a precedent. So you can't come and say, oh, we're not the ones that collected your data in the past. We're going to be nice. There's one black researcher in our team, so you got to trust us because we're, this black person is the unicorn. No, you have to be willing to do the work. You need to be able to show your working, your work plan. You need to be willing to invest in that community and engage the community at every level. For example, there's a, a tool that I applied while I was an addictions coordinator in the First Nations communities, and that's every time we did research, all of our research assistants were from the community. We never approached an elder without a community member, either it's youth or a fellow senior. Those are things that we need to do. We need to employ this every time. You cannot pay other people outside of the community to come do research in their community. They're not gaining anything from it. They can't trust you because nobody knows the back end. Nobody knows the workings. For example, someone in that community will be like, oh, I'm on the research team. No, the intent is correct. The intent is true. Then, this is what we do with the data. We have processes in place. I do this every day that I, engage with people. We've already had trainings. Everyone is on the same page. Now that's buy-in from the community already. You don't even have to do the work. You don't even have to advertise or try to incentivize people to participate in that research. They will wholeheartedly participate. However, we need to do the work. So you need to make them trust you. For them to trust you, it's a precedent. Trust builds trust. You cannot, I repeat, you cannot tokenize engagement and then expect trust.
That's
Thank you.
a great point about token. Oh, sorry, Jackie. I was just going to say it's a great point about tokenism, and so many other factors I think are really important too, just in terms of compensation as well for those you're engaging. I think these are great points bringing up. Did anyone any last thoughts on this area before we move on? All right, with that, I will move on to our next question. So as we start to look ahead to the future, and I think we've started to touch on this a little bit as well, but what do you foresee as the biggest challenges for ICES to overcome when it comes to establishing community-led data governance? And really, how do we go about starting to think on navigating these challenges? And I will definitely circle back to everyone on this last question because I think it's really important to think about as we kind of think about starting this journey. So Manvir, maybe I'll start with you for this question.
Sure. Thank you, Laura. I think the number one thing that's going to be a challenge is going to be it's going to take some time. It's going to take a lot of time. And I think, Gurjit alluded to that earlier as well, establishing new partnerships or restoring partnerships that already exist, building trust, building roadmaps that are collaborative. It's going to take time and money. So I think that's going to be one of the things that will be the biggest challenge, but also it might also get very uncomfortable for ICS to think about internally, to think about what are some of the challenges or the barriers that exist within ICS when it comes to supporting or establishing community-driven data governance models. And I think that's something that is necessary for this work and needs to happen, like an internal audit of individuals, an internal audit of processes that exist, historically, the marginalization that exists, any racism, and I think we want to think about applying, and I say this, applying an anti-racism and anti-oppressive lens when we're doing this work, but not just saying that on your website or not just putting that into your messaging, right? But truly embodying that at every step of the way and making sure that you're engaging community at every step of the way and not just, for tokenism, as Bilqis mentioned, right? It's got to be authentic. It's got to be true. And it's got to, and trust me when I say this, we can feel it when it's not genuine or true. As leaders in our community doing the work that we do, we can feel it when it's a photo op, we can feel it when it's tokenism, and it's very easy to tell. And I think and that goes across different marginalized groups or different communities that we're trying to engage. um, and it's not hard, and of course I think building trust takes time, but people are not opposed to it. People want to work together, especially if it benefits our populations and equity seeking groups within our communities. But we also want to make sure that it's done in a way that's not further marginalizing someone or oppressing them. um, but it is possible. So I don't want to leave it on a sour note, but it will be an uncomfortable journey, a long, uncomfortable journey. But I think it's a necessary journey for ICS to embark on, and leverage people in the community that can support you and you can lean on, who are experts in this work or who champion this work daily.
Yeah, Gurjit, go ahead.
Yep, thank you for those points, Manvir. I totally agree with what you're saying. It is going to be a long, hard journey, but a journey that requires, some creating some braver and safer spaces within ICS to have these conversations, to unlearn and learn in new ways about doing this work, the work that you do every day, around whether it's research, holding data, using the data, publishing, et cetera. All of these things, all the functions that ICS has, will need to be looked at from the lens of, what biases exist, where the power is held, what identities are being represented or not being represented at the table, or any table, or if there's tables that need to be created or spaces that need to be created. This work is emotional, it's difficult, it's hard work, and I really think that's very important for us to emphasize. And I think all panels have emphasized it in some way or another, that you're going to have to put your heart forward with this work, because these communities, and we're all part of these communities, all panelists here, and other communities that are not at the table as well, will feel the difference, and that's what's going to make it work. If they feel it, they will come along. If they don't feel it, they're not coming along. And if you see they're not coming along, you're doing something wrong. And you need to stop and look at yourselves and say, what am I doing wrong? And figure it out. And don't put the burden on the community. Don't put the burden on the Black person in your team, the brown person in your team, the Indigenous person in your team. They carry enough emotional burden. They carry enough trauma. Please be respectful and really do your own work. And I'm speaking to my white colleagues right now. So please do the work.
Thanks so much, Manvir and Bilqis. Great points highlighted. Manvir and Gurjit, and I'll pass it to Bilqis for more comments.
Thank you. I was itching to go. So, number one, I love that ICS's leadership has its heart in the right space. And the reason I know this is because I used to be on the Patient Advisory Council for about 2 years. And as you can already tell, I have a strong voice, and I wasn't kicked. I never for once felt like I was offending someone. I wasn't uncomfortable. It really was a safe space. And so I'll give you your flowers and say that you're already on your way to the right outcomes and on your way to doing well. And I love what Gurjit said. I'm taking this with me. This is my takeaway. It's hard work. And in speaking to that, is that it's important to introspect. Introspection is very important in how you grow, and you need to be able, the persons you're working with, the communities you're working with, need to feel like you're doing something. They need to feel that they can trust you. And how can you do that? Beyond each an individual interaction, you won't get the opportunity to meet with every community member. Community members come and go. Some people will leave in that community after you've exited. However, you can leave tangible tools or tangible outcomes in that community. For example, when you do a research study, you do a publication. Where's that publication? Is it is it a living document in that community? Did you create a poster in understandable language that the community can, glean from and say, oh, these are some of the issues that were highlighted now in our community. These are some of the things that we're doing well. These are the ways that we can improve on these outcomes. So that's one thought, and that's an idea, especially for the researchers on this platform and in this program at this point. And speaking to the actual question, is that how do we manage the expectations? You need to focus on impact. What is the theme? What is the project? What is the agenda that will have the greatest impact? Something of a domino effect. Something that, if you're able to handle that, will transcend and just transpose itself into other things, other discussions. One pivotal thing we must do is to differentiate evolution from distraction. The thing is that once we're able to resolve an issue, or some novel discussion is happening, everyone wants to button. It's like, oh, how about me? How about me? How about me? Differentiate evolution from distraction. Thank you.
Thank you so much, Bilqis. There's just such important points, I think, that are all weaving together from this discussion. And Bilal, I'll hand it for you for kind of last words on that question.
Yeah, I think Gurjit, Manvir, and Bilqis really mentioned a lot of important things that are overlapping with what I was thinking. I think, one of the things that comes to mind is the power shifting that is required, which is like simply giving communities decision-making power on everything about their data. And it's a long, uncomfortable journey, as Manvir mentioned. And historically and presently, research has been extractionary. We have to admit that it has been extractionary, with communities examined through like a microscopic lens with little to no benefit of this research to the affected communities. And this is an ongoing challenge to overcome, but there are benefits of overcoming this challenge. And I believe that ICES, as Bilqis had mentioned, has started that journey to overcoming this challenge with a lot of like internal reckoning and hard work, as was mentioned, of how data has been used in the past and how it should be used in the future, giving power back to the communities. And when you shift power to communities to decide how their data will be used, they can leverage that data to explore the needs and issues specific to their communities and their context, and then address those issues while maintaining the dignity and respect of the larger community. I think that's such an important aspect of this. Um, and I think Bilqis touched upon the impact, right? So the impact of a lot of this using of the data and collecting this data is developing programs and services that are going to improve the outcomes within these communities. And I think we clearly know how these communities are faced by adverse social and health outcomes. Knowing this, the purpose of community-led data governance should be to improve outcomes and also critically kind of examine the root causes, which is racism, discrimination behind those outcomes. So yeah, I think it's a big challenge, but I think not to leave off on a sour note like Manvir, I think there's definitely work being done, but there's more to do.
Excellent. Thank you all so much. This has been really, really insightful and lots to think about as we begin our journey down this path. I'll just pause for a moment to see if there's any last thoughts from our panelists before we have a few minutes to answer some audience questions. So, any last thoughts from anyone?
No last thoughts, but I hope that as you're listening to us, you're taking away some of the words that we've used today. And I hope that it will help to inform your decisions as you move forward. And perhaps it will trigger and ignite your conscience. And that's that, there are benefits to overcoming these challenges. And those benefits are for everyone. It's not just for the marginalized communities. You have to make sure that there's introspection at every level of this engagement and involvement. It is hard work. It's not really about the doing and the photo ops. It's hard work. Make sure that you're sharing the tangible results of your adventures, of your ventures and projects with the communities involved. Ensure that communities are empowered as you come and as you leave. Ensure that those projects are also tailored to the specific needs of those communities. We hope and we beseech you to take these to heart as you move forward and as you engage. Thank you.
Thank you so much, Bilqis. A great note to end on too, because absolutely there's so much mutual benefit from this work in the short term and long term. So I think that's a great point to emphasize. Well, so about 5 minutes left for audience questions. So I'll just scan here and see what we have coming through and try my best to answer a few of these. So there is the first question I see is, how has ICS committed to building capacity in communities for data governance to limit the burden on equity deserving groups, which I think is so much of what we just talked about as well. And I think, as I mentioned, we are in the process of kind of early days of this work and thinking about consulting community members. And that's really where we started. We've conducted a series of consultations to talk with people in the community just to understand, what is even the first place to start? Where do we start? How do we think about conceptualizing this and doing it in a way that's not going to cause harm and not going to cause burden? I think it's important to acknowledge we will make mistakes as we go. This is kind of our first journey through this, and there's so many things our panelists highlighted today to take into account and consider, which will be very helpful as we start this journey. But I think it's a learning for us, a learning and a growth, and something that we look forward to kind of starting and really co-designing with communities and building that trust and relationships. And I don't know if there's anything the panel members wanted to add to that piece, but by all means.
I totally agree with you, Laura. The other thing I was thinking about while you were speaking is humility and vulnerability. When mistakes happen, we need to be humble, and we need to, as Bilqis and the other panelists have mentioned, introspect. We need to be vulnerable. We need to see where our biases are. And this is not to say that those that even represent marginalized groups or are themselves part of, the BIPOC community won't make mistakes either, right? We're very diverse, and everyone's on their own journey around dismantling internalized discrimination and racism and white supremacy. So I think if we really think, like we said earlier, about the heart, driving with the heart, knowing that we're all human, we all make mistakes. But again, even when you make a mistake, if the community that you're working with can feel that your intentions were good and you were trying to do the right work, they will forgive you. And I think they will move forward with you. But if it's really tokenizing or superficial, then they won't. And they can easily tell. It's so easy to tell. So I think the mistakes piece, don't be fearful of failing. That is hugely important in this work.
Thanks so much, Gurjit. And anyone else have anything to add on that point? Sorry, with that, I think we have time for one more question. So I'm just going to quickly scan here to see what has come in. And I know there was a few comments about the OCAP principles. So I think it will also be helpful to kind of refer back to the link that Michael shared as well for our Indigenous portfolio at ICES. And there's just a comment here, but providing a lay summary of research to any research participants is a huge issue in the research community, and it needs to have bigger commitment from researchers, both private and public, to really engage participants and show them that the research can be useful. And absolutely, I think that's a really important point. A lot of what we're talking about too is, I think it was Manvir that mentioned, someone in the community may not totally know about this or know why we're doing this or be as well versed in research. So I think thinking about how you're translating that knowledge and how you're communicating with whether it's community governance or whether it's a larger research project, you really need to think about how you're reaching folks and doing it in a way that's going to be equitable and obviously easily translated to other people. I'll stop there. We have about a minute to see if any panelists had anything further to add on that point.
if I can quickly add on to this, and I think this is a huge piece in research, especially when translating knowledge to the affected communities. And I think even things like translating it into the language, or providing infographics or things where people see themselves in the knowledge that you're translating is such an important piece of this. And I think that is a small step, but it can do wonders in terms of relaying information and really allowing the communities that are affected to understand, okay, this is the issue and this is how we're trying to improve the outcome. I think those things are not done as much as we'd like to see, and they need to be done. That's just one small example, but they need to be done much more.
Great. So with that, I believe we're at time, and I would just like to sincerely thank all our panelists today for sharing with us their thoughts, their insights, and such valuable points as we move forward in this journey of data governance, and hopefully beyond as well. I hope the session was informative for all of you, and I think we'll end here and transition to our keynote speaker starting at 2 o'clock. So thank you again to everyone for listening, and thank you so much.
Thank you, Laura, and thank you to all the panelists for a really excellent and thought-provoking panel discussion. Lots of work for us to do, but lots of great input to support it. So we're going to go straight into the next keynote session, but you need to exit this and come back, go to the lobby and come back in to the next keynote session. So I'll meet you there in a minute or so. Bye for now.